Let's talk about some of the issues that we all face as clinicians or some of the mistakes we've made. I've made them all. You may be making them or you're making them currently. That's why we're having this video. So hopefully this will help you out. First one, not thoroughly questioning out symptoms. So what does that mean when we're not thoroughly questioning out symptoms? Well, one, you need to not just, because let's just say we have a patient with lateral elbow pain on the left and we just tunnel vision in, we question, we do all the palpating, because again, if there's nerve issues, you're going to get tenderness at the lateral elbow, which if we're really anchored on this being a lateral elbow issue and lateral epicondylalgia, you're going to start digging and finding sensitivity and, my diagnosis is made. This is just a lateral epicondylalgia, nociceptive dominant. But we want to question out, like, where are these symptoms distributing? And I tell students that I mentor and clinicians I mentor that you need to question out from the spine all the way down to the distal extremity through that area of symptoms. So any current or past symptoms in your neck or into your top of your shoulder, any symptoms in your upper arm, any symptoms in your lower arm, any numbness, tingling, we're going to question out all those things from the whole distribution of where a nerve could be. And it's just good common practice to do that, where you're going to ask these questions to understand. If the patient says, yeah, I got this lateral elbow pain, I also have this pain on the outside of my wrist, and I got this pain on top of my shoulder. And recognize patients sometimes don't offer this information. They don't understand that there's a connection to this thing. Their pain may be worse at the elbow, and that's where they find that they need to discuss with you. So they don't draw it on a body chart. They don't discuss it in clinic because they see that as separate issues. But us, as a wise clinician or as somebody who understands neuropathic pain, you're going to start hopefully connecting the dots that, hey, they got lateral wrist pain, lateral elbow pain, and neck pain. That sure lines up with a possible neuropathic pain condition.